I'm about to graduate. So I just wanted to, it's so weird to say that. I just wanted to kind of like update on my expectations coming into fourth semester to what the reality is of being a senior in the nursing program, or being in your last semester of the nursing program. So as I have mentioned before, I am in an ADN program. I am completing my associate's degree in nursing, and with that I'm going to be able to take my NCLEX in the summer. I graduate June 10th is my final, June 11th is my pinning ceremony, and then after that it takes like a month or two for the paperwork all to get processed, which is, guys, it's so much more complicated than I thought. So much paperwork goes into it. Of course, they're not just trying to let anybody go take the NCLEX. They want to make sure it really is you. We just did our fingerprint live scan today. But yeah, so it's a lot of paperwork that needs to get processed through not only my program, through my program director and like the counseling office of the nursing program, but also through the boards of registered nursing here in California. That takes a quick minute, and once that's completed, then I get my authorization to test, my ATT. And once I get notified that I can test, I can go ahead and sign up for a test date and take my NCLEX. I get to take my exam in like early August, late July, and then I'll be able to be registered and get a job, which is all fun and exciting and very nerve-wracking, but very much more exciting than anything. So coming into fourth semester, I remember we said that third semester, everybody in my program says third semester is the hardest. Third semester is really intense. If you can get through third, you'll be fine and you'll get through fourth. And I was like, okay, I just need to make it through that third semester because that's like the big kahuna, you know? I'm like so like in my brain because there's so much going on. And yeah, I'm like, okay, girl, tone it back. You need to take it one step at a time. I was literally looking for jobs like a week ago. And I'm like, Jackie, you haven't even taken your last topic exam. Like, it's just exciting, and I'm trying to like get ahead of the game. I'm trying to look. I've been doing a lot of research. I've been watching a lot of YouTube videos and reading a lot of blogs about how people test for NCLEX, what they do to study, what their methods are, and of course I'll share that once I get there. I think I know like the kind of route I want to take in terms of how I want to study for NCLEX, but for now, like I just said, I need to tone it back. I have been trying to look for jobs, kind of see what they're looking for, what kind of paperwork they're interested in, what are the requirements, just so I can get an idea of which hospitals I should be looking at, because I do not have a bachelor's. I do not have my bachelor's in nursing. So there are some hospitals that require only BSN, especially their magnet hospitals, but there's quite a few hospitals around me, especially county hospitals, that are very much okay with just having your AD. But I did get accepted into universities are into BSN program, and so I will be attending there. I already enrolled into 4 of the classes, and my orientation date is June 17th, I think, and then I'm going to be attending that school in the fall, which I'm very, very excited about. I went to Cal State Dominguez Hills for the first 2 years of my college life because I thought they had a nursing program, and they do, but you only have the RN to BSN option. You cannot do the full BSN option there. So that's why I had to go to a community college, like 4 different community colleges, just to figure out that whole nursing thing. Now that I'm getting my ADN, now that I'm going to be licensed in the summer, I can go back and finish my bachelor's. So I'm very excited for that. I'm very excited that I get to kind of finish where it all started. It's like full circle. Coming into fourth, as I've been saying, third was the big kahuna. Third semester was very difficult, and it did not disappoint. It was very difficult, very different, a little more cold, a little more intense, but you knew what you had to do. They were clear about what you had to learn. And I still enjoyed very much the lectures and the information that we were learning. So I passed all my exams, I passed their semester, and I had my first panic attack in third semester, and I remember thinking, I'm good, I'm done. Like, fourth semester, we're good to go. I can do this. I can do this, but I shouldn't have thought it was going to be as easy. I was thinking in my head. I was thinking it was going to be much more straightforward and a little on the easier side, and it kind of is, but I didn't know what I was expecting. I don't know why I was expecting for it to be easy. It can't be easy. We're freaking learning body systems and the science of it all. It can't be easy. But I didn't think about that over winter break, obviously. So we took our first exam, and that was so difficult. It was leadership and management, and I think I talked about that already, but it was so difficult. And that was probably my worst grade thus far, which was probably like a 78%. I think I got a 78 or 76% on that exam. And that was my worst, but we need a 75 in the class to pass the semester. So I was like, okay, I just need to get higher than this for the rest of my exams. And yeah, I maintained like 84s and above. I got a 90 at one point, and then we just had our neuro exam on Monday, and I got 100%. So now I'm at a very comfortable level. I'm at a very high B. I did the math because obviously we're trying to calculate every little point and making sure we're gonna pass. We have ATI Med-Surg on Monday, and if I get a level 2 on that, I can afford to miss 60 questions on the final and still pass the class. So I'm very comfortable. After Monday, I felt even more comfortable, and I'm like, okay, there's only 2 more exams I count for my grade. We got this. So that's what I've been doing pretty much this week. I've been studying for ATI Med-Surg, but the thing is that in 4th semester, it's not just your core classes. We also have ATI added into our program. I know a lot of different like schools, they do HESI, they do Kaplan, they do ATI, we do ATI. And so with ATI, there was, in 4th semester at least, we get an added course. We get the ATI Leadership and Management exam, and then we get the ATI Med-Surg exam, and then we have the ATI Comprehensive Predictor exam, in which we have to pass. It's basically our exit exam. We have to pass that exam. In order to graduate, we have to pass that ATI Comprehensive Predictor. You get a retake for all those ATI exams, so that kind of eases your mind too. Apart from that, we have ATI Capstone, and that's sort of a ongoing program through ATI's website that is kind of refreshing all the content that you've learned over the past 2 years. So we had the Med-Surg module, then we had the fundamentals module, pharmacology, maternity, pediatrics, leadership and management, community health, psychiatric. We had all of the modules, and it was just like weekly concept maps that we had to look at, and quizzes, practice questions, a full-on assessment, and then remediation that our online coach assigned to us. It wasn't necessarily difficult, it was just a lot of tedious work, a lot of kind of like busy work that does help you because they had great like NCLEX tips or great weekly tips of overall summarizing the most important numbers to memorize and drugs to memorize for each topic. And so I made sure to print all those out, and I have them all in my binder. That finished in the first 8 weeks of school. Then we had our spring break, and when we came back from spring break, they told us, now you guys are done with Capstone, now you have to do virtual ATI. And what virtual ATI is basically the exact same thing as Capstone, but it's not as rigorous in accordance to due dates, and we don't have to do every single module. We need to get only, I think it's to 50% of completing the whole virtual ATI course in order to be eligible to take the final and then be eligible to like graduate. To get to the 50%, we just need to complete the fundamentals module, the pharmacology, and then the Med-Surg modules. So I've actually completed the fundamentals and pharmacology already just because I wanted to get them out of the way, and I wanted to be studying the Med-Surg module at the same time that I was studying for ATI Med-Surg, just so I could utilize the resources they were gonna make me do and work on anyway to help me with my exam on Monday. So that's what I'm doing right now. Also, I'm trying to get that Med-Surg module completed. I'm trying to watch Kathy Park's YouTube ATI Med-Surg videos, and I'm trying to just take a bunch of practice questions on ATI, and hopefully I can pass and not have to worry about it and get all of the points. But yeah, the way virtual ATI works is that we complete those modules, but each module has the concepts maps that you look at again. They have 3 practice quizzes roughly that are about 30 to 35 questions each. So that's already 100 questions right there. And then you're supposed to take your assessment, which is 60 questions, and you submit all of those scores to your coach. And then the coach sends you remediation. And the remediation is a lot more, it's a lot more just in general. It's just more work than it was when we were doing capstone. So with ATI Virtual, the remediation looks like you may need to do some modules, skills modules on the ATI website. You will have to take another few practice quizzes, your like focused review, but you don't have to do templates like you would when you turn them in at your professor. Instead, you like do your focus review and you have to pick 5 or 6 or how many ever topics she tells you to do and summarize them to her on what you learned from each topic. So I'll take those seriously and I'll pick topics that I genuinely didn't really know, especially if it's a drug I never really hear. I'll pick that one, like theophylline. I don't really hear it in the hospital, so I kind of forgot that it was I already forgot. It's an antiplatelet aggregator, I think. Well, I'll put that in. I'll tell her what it is, what are the side effects, and what's like big patient education on it. And same thing for fundamentals and same thing for med surg. So it's a lot more work that you have to do. You have to be really good about like checking your message, making sure you're completing every single task, because you might like skip one. But again, if you skip one, the worst that will happen is when you send them to her, she'll just let you know, hey, you forgot to do this, do it, and then let me know that you completed it. So it's good. The work is all laid out for us. It's just a lot more than what I've been used to in the past 2 years. So it's just a lot more being organized. So I'm doing pretty okay because I feel like I'm very organized. I have my calendar on my whiteboard, on my actual calendar that's hanging above my bed, and then I have my agenda, like my actual book calendar. And in all 3 places, I have all the important dates that I need to be wary of and make sure I'm completing X, Y, and Z assignments, etc., etc. So far, so great. I'm completing the med-surg module between today and tomorrow, and then I'll already be at the 50% and will, according to ATI, be ready to graduate. It's all happening so quick. We had picture day last week, actually, our full picture with the whole cohort, and I mean, you're gonna have the people you like and the people you don't like, but at the end of the day, those 40 people are people that I've been with in the past 2 years, and we struggled together, we've had successes together. So I'm very excited. They just sent us the pictures today to our computers, to our emails, and so I'm gonna print it out and like have it hanging in my room because it's been a wild ride. Yeah, so we have our pinning ceremony June 11th, and so we are at May 16th. We literally have 25 days left of school. We only have one clinical left, and 3 exams, our ATI Med-Surg, ATI Comprehensive Predictor, and our final. And it's crazy. It's happening really quick, but I'm very excited. Yeah. This is just all over the place because this is just me expressing how excited I am to graduate. And it's still nerve-wracking to get to the finish line, but I'm no longer feeling anxious about passing an exam. I'm no longer feeling too nervous that I'm not going to pass. I know I'm going to pass. I just need to keep studying and do what I've been doing, but I'm on a comfortable spot right now, so I'm pretty good. And yeah, I'm just trying to figure out, do I want to work over the summer? Because once I get a nursing job, I'm going to be working for the rest of my life. Do I want to like go somewhere for vacation in the summer? But I also know that I want to really focus in on my studying for NCLEX, but I also should celebrate and maybe I'll take a day or 2 off here and there, but should I take like a whole week and go to another country? I really don't know. So that's where I am at right now, being excited and trying to figure out my summer plans, but we will see. Again, this is just all over the place because I'm just word vomiting the excitement I'm feeling because I am 25 days out from graduating. And I'll probably make a video based on how I do with ATI. We'll see how I go with ATIs. Wish me luck.